Do you think you know everything about your wife in bed? Do you think what pleased her 20 years ago still pleases her today? Or have you noticed a change and haven't been able to explain it? 2 weeks ago, a man in his 60s, a respectable and self assured man, sat before me, but he looked at me with genuine bewilderment and said, Dr. Mariana, I've been with my wife for over 30 years. I used to think I knew her better than anyone, but for the past few years, I felt that something has changed, and I don't understand it. She doesn't complain, but I feel that things aren't the same as before. I asked him, Have you tried asking her? He paused for a moment, then said, I don't know how to ask. I'm afraid of embarrassing her or myself. This is a problem faced by millions of husbands in the Arab world. Men who love their wives but don't understand what has changed. And women who suffer in silence because they have no one to listen to them or explain things to them. Today, I will break this silence and reveal to you some real secrets about women in bed after 50. Secrets that, if every husband knew them, would completely change his married life. I'm Dr. Mariana, a urologist with over 15 years of experience in men's and women's health. Every day, I sit with couples who confide in me about the most intimate details of their lives, things they wouldn't even tell their closest friend. Over these years, I've discovered that the problem is often not primarily medical, but rather a matter of understanding. The man doesn't understand what's happening in his wife's body and mind, and the woman doesn't know how to communicate her needs to him. Today, I will be the bridge between you. Before we begin, please hit the like button and let me know in the comments which country you're watching from. This video is for every man who wants to understand his wife more deeply, and for every woman who wants to send this video to her husband instead of explaining herself. So please like it so it reaches those who need it. Let me be completely honest. There is a great deal of ignorance in our societies about what happens to women physically and psychologically after 50, and this ignorance causes real damage to marital relationships. The first problem is that the man measures things by his own standards. He thinks that what arouses him should also arouse her, and that his response should be the same as hers. When this doesn't happen, he feels rejected or thinks the problem lies with him or her. The second problem is that women over 50 go through physical changes that go unseen by outsiders. Pain they don't talk about, dryness they don't know how to treat, changes in sensation they don't understand. And they endure all of this in silence because culture has taught them not to complain. The third problem is that both parties are too shy to talk about it. The man is too shy to ask, and the woman is too shy to speak, resulting in them living on separate islands under the same roof. Imagine you're sitting in the same room, but each of you is speaking a different language. The feelings are there for both of you, but there's no translation. Today, I will be that translation. I'm going to reveal 8 real secrets about women in bed after 50. Get ready, because some of these secrets will completely change your understanding. The first secret: her body doesn't respond in the same old way, and this isn't rejection. Medically speaking, after menopause, estrogen levels drop significantly, sometimes by as much as 80%. This decrease affects everything. Blood flow to the intimate area decreases, tissues become thinner and more sensitive, and the natural lubrication that used to occur automatically is noticeably reduced. Think of it this way. Imagine you've been watering your garden with an automatic irrigation system for years, and then suddenly the water pressure drops to a quarter of its previous level. The plants aren't dead, but they need a different watering method. Emotionally, a woman feels frustrated with her body and wonders, why am I not the same as before? When she sees her husband's frustration, she feels doubly guilty. This combination of guilt and frustration makes her withdraw even further. Practically speaking, as a husband, you need to do 2 things. First, understand that this change is biological, not psychological or emotional. And second, know that there are simple solutions like daily vaginal moisturizers and water-based intimate lubricants that make a big difference from the first use. The second secret: pain is a silent secret that you hide from yourself. This secret often shocks men when they first hear it. Medically, more than half of postmenopausal women experience what's called dyspareunia, which is pain during intercourse. This pain is real and physical, not psychological. It's caused by the drying and thinning of tissues and a decrease in elasticity. Imagine trying to bend a piece of dry skin instead of a supple, moist one. The dry skin will crack and hurt. Emotionally, a woman who experiences pain every time begins to associate intimacy with pain rather than pleasure. The bedroom transforms from a place of closeness into a source of anxiety. She won't tell you because she's afraid of disappointing you or hearing things like, all women are like that, or you're exaggerating. Practically speaking, if you notice your wife becoming tense, avoiding intimacy, or rushing to finish, don't assume she doesn't want you. Sit with her quietly away from the bedroom and gently ask, "Are you experiencing any pain or discomfort? I want to understand so we can both be comfortable." This question alone might unlock a door that has remained closed for years. After that, he encouraged her to visit a specialist doctor because medical solutions exist and are effective. Sultan, 55, came to me after enduring the pain for 3 whole years without telling anyone. Her voice trembling, she said, "Doctor, every time I bite my tongue and bear it, and my husband doesn't know." I asked her, "Why didn't you tell him?" She said, "I'm afraid he'll be upset or feel like he's the cause." I prescribed a simple topical treatment and advised her to use a water-based lubricant, and most importantly, I told her to talk to her husband. 2 months later, she called me, crying tears of joy. "Doctor, since my husband found out the truth, he's become kinder and gentler, and the pain has disappeared thanks to the treatment. I feel like we're back together." The third secret: introductions have become more important than ever. Number 3 is the secret that, if a man understands it, will radically change his relationship. Scientifically, studies prove that women over 50 need significantly more time to reach full physical arousal compared to their younger years. This isn't a flaw, but a natural physiological change linked to decreased hormone levels and altered blood flow. Think of it like the difference between lighting a match and lighting a charcoal stove. A match ignites in a second, but a stove requires time, patience, and ventilation to reach the desired temperature. And when it does, its warmth is deeper and lasts longer. Emotionally, when a man rushes, a woman feels like just a step in a process, not a partner in an experience. This feeling extinguishes any spark of desire that may have begun. Practically speaking, dedicate more time to foreplay, and I mean real time, not just a few minutes. Talk to her, laugh with her, let her feel that you are fully present, not just physically. Foreplay doesn't begin in bed. It begins with a kind word you say to her at dinner. The fourth secret: women over 50 know what they want better than ever before. This secret will be a pleasant surprise for many men. Scientifically, although physical responses change, a woman's body and psychological awareness increase with age. After decades of experience, she comes to know her body more deeply and understands what pleases her and what doesn't. The problem is that she often doesn't find the safe space to express this. Emotionally, a woman over 50 wants to be heard. She wants a partner who asks questions, listens, and adapts, not one who assumes he knows everything. The biggest mistake a man can make is thinking that what worked in her 30s will work in her 60s. Practically speaking, ask her. Yes, it's that simple. Ask her what she likes, what comforts her, and what bothers her. Don't assume, ask. And when she tells you, listen without defensiveness or sensitivity. This conversation alone will bring you closer than anything else. Abu Nawaf, who is 63, told me something beautiful after I advised him to talk to his wife. "Doctor, from the day I asked my wife what she wanted exactly and listened to her, I discovered that I had been playing the piano with the same note for 30 years. When I changed the tune, the playing became sweeter for both of us." The fifth secret: emotional security is the key that unlocks all doors. Stop right there, because this secret is the foundation upon which everything else rests. Biologically, a sense of security activates the parasympathetic nervous system, the part responsible for relaxation, comfort, and sexual response. Conversely, fear, tension, and pressure activate the sympathetic nervous system, the fight or flight system, which completely suppresses desire. Simply put, a woman cannot feel desire when she is feeling fear, pressure, or judgment. It's impossible. Emotionally, security means knowing that you won't criticize her if she says no one night, that you won't compare her to others or to how she used to be, that you accept her as she is now, with all her changes. This security is what allows her to open up, relax, and enjoy herself. Practically speaking, never comment negatively on her weight or body shape. Don't pressure her if she's not ready. Don't express your frustration in a way that makes her feel guilty. Instead, tell her, "I'm here and I'm not in a hurry. Whatever makes you comfortable makes me comfortable." This sentence alone can open a door that has been closed for years. The sixth secret: sleep and general health affect everything in bed. Number 6. Directly links overall health to intimacy. Biologically, lack of sleep raises cortisol levels, which suppresses sex hormones. Obesity affects blood flow and hormone levels. Chronic illnesses like diabetes and high blood pressure and their medications can affect sexual response in both partners. Emotionally, when a woman is exhausted, sleep-deprived, and burdened with household and grandchildren responsibilities, intimacy is the last thing on her mind. This doesn't mean she doesn't want it, it simply means her energy is depleted. Practically speaking, help her sleep well by minimizing distractions in the bedroom, share some household responsibilities, and encourage her to walk and move around, as exercise improves sleep, mood, and libido. And take care of your own health as well, your weight, fitness, and sleep. Your combined health is the foundation of your intimate life. The seventh secret. A woman over 50 needs to feel desired, not just needed. This difference is subtle yet profound. Scientifically, feeling desired by a partner triggers the release of dopamine in the brain, the reward and pleasure hormone that ignites desire from within. Emotionally, there's a significant difference between a woman feeling that her husband needs her physically and feeling that he desires and craves her as a woman. The former makes her feel obligated, while the latter makes her feel alive. After 50, when the body begins to change, wrinkles appear, and hair turns gray, a woman needs more than ever to hear and see that she is still beautiful and desirable in her partner's eyes. Practically speaking, look at her with admiration, and don't stop just because you're both getting older. Tell her, "You look amazing, you're so beautiful, I need you not just as a wife, I need you as a woman." These words will do more for her than any medicine can. The eighth secret, renewal is not a luxury, but a necessity. And the last secret, one of the most underestimated by couples after many years of marriage, is this. Biologically, the brain adapts to routine and reduces its response to repetitive stimuli. This is what scientists call neural habituation. In other words, routine itself can extinguish excitement, even if love is still present. Emotionally, when intimacy becomes routine and predictable, it loses its spark for both partners. The woman feels like she's going through the motions, and the man feels like things have become boring, and both blame each other when the problem is the routine itself. Practically speaking, change the time, the place, and the method. I'm not talking about complicated things. I'm talking about simple things. Instead of late at night when you're both exhausted, try a different time on a weekend. Refresh the atmosphere in the room with different lighting or a new fragrance. Take a trip together, even if it's just for a day. Breaking the routine brings the brain back into a state of alertness and excitement, as if you're rediscovering each other. Abu Khalid, who is 65, laughed and said to me, "Doctor, my wife and I have never traveled alone without the children." I advised him to take her on a short trip for just 2 days. A month later, he called me laughing and said, "Doctor, we traveled, and the day we were away from home and responsibilities, it was as if something in us was restored. My wife became a different person, and I became a different person. We came back as if we were on our honeymoon." So, here's your action plan to get you started this week. The first step, choose a quiet moment and sit with your wife and say to her honestly, "I want to understand you better. Tell me what I can do to make you more comfortable." And listen to her without interrupting. Step 2. Start today with daily acts of kindness, without any expectations. A morning hug, a handhold, a sincere word of appreciation, every single day. Step 3. If your wife is experiencing any pain, dryness, or discomfort, gently encourage her to see a doctor. Offer to go with her if that makes it easier for her. 3 clear and simple steps. No budget, no schedules, no complicated plans. Just understanding and sincere intention. Within a few weeks, you'll notice the distance between you shrinking and the warmth returning. I want to say one last thing to every man watching right now. If you're feeling confused, frustrated, or even like you failed as a husband, I want you to know something important. You haven't failed. You simply need information that no one has given you. The fact that you're watching this video means you're a man who cares and wants to understand, and your wife isn't broken or lost. Her body is going through a new phase, and all she needs is a husband who understands, is patient, and stands by her. After 50, 60, or even 70, your relationship can be deeper, more beautiful, and more intimate than it has ever been. It's never too late. If you found this video helpful, please like it so it reaches as many couples as possible who need this information. Let me know in the comments, which of these 8 secrets surprised you the most? Feel free to share this video with a friend, brother, or any man you know who needs to hear this. Subscribe to the channel and turn on notifications so you don't miss any of my weekly videos about men's and women's health after 50. You could be the reason a marriage is saved with just one click of a share. I'm Dr. Mariana, and I want to remind you that after 50, the bedroom isn't the end of the story. It's a new chapter, and it can be the most beautiful if you know how to read it. Take care of yourself and your loved ones, and I'll see you in the next video. Remove these words.